here that says my mother recently had a biopsy for a lump in her breast and the report says atypical cells present. Does this mean that she has cancer? What should we do next?
Yeah, that's a great question. So the first thing to do in such a case is basically have a qualified pathologist review the slide. So when it comes to a breast lump, there can be several reasons. There can be on mammography or even on clinical exam, one can find a lump. Most of the lumps are benign in nature, but sometimes you can have cancer hiding within them. And so if there is a reason for atypical cells, those cells need to be interrogated further. So in this case, what one needs to do is additional testing, such as immunohistochemistry, which can help identify whether these are cancerous cells or benign cells. Benign meaning normal, they are just part of your normal breast tissue. The second thing is if on the immunostains there does appear to be suspicion that this might be cancerous, then one needs to do additional testing, including molecular testing such as FISH, to identify if these indeed are if there are tumor cells there, whether they are high grade or low grade. So those things actually can be done at advanced institutions, certainly in the US, from these samples. But when especially atypical cells, when a report comes back as that, it's a red flag. It's not something to worry, but one needs to find the right people to do the confirmatory testing to either rule in or rule out cancer.
hmm So when you say that could also not be a red flag, what else could it be, doctor? Like, if it.
So you can have inflammatory cells sometimes when there is mastitis or inflammation of the breast. Those cases have atypical cells, but the atypia in those cases is reactive. It's not really tumor. It's not cancer. So these cells are basically kind of revved up because of the inflammation and all this background noise going on. That what causes them to morphologically appear atypical. So this is not truly cancer. Again, you can have atypia, you can have a benign malignancy, a benign tumor like a fibroadenoma, which is a very common, relatively common proliferation or neoplasm in the breast. It's not cancerous, but one has to identify, they might appear atypical, but one has to identify with further investigation whether this is benign or malignant.
hmm Thank you so much, doctor.